Do you know what happens when you pour acid on something? Like on this flesh. It burns. It burns and destroys it. The more you pour the acid, the more it destroys it. That is exactly what arthritis does to the joint. My name is Dr. May, the arthritis doctor. Pay attention because today I'm going to bring you a very important information concerning arthritis. Now, arthritis is like when you have an acid burning into a flesh. Arthritis steadily, progressively destroys the joint. The more the arthritis stays in the joint, the more it destroys the tissues of the joint. Most times it starts from the soft tissues like the ligament, the tendon. Gradually it involves the cartilage and finally the bones. That is when it deforms that joint. By that time, it has successfully destroyed the joint. So let me use this knee joint to demonstrate what I've been talking about. This is arthroscopy of the knee joint, using camera to look inside the knee joint. When the knee joint is free of arthritis, you can see how smooth the cartilages are. Femoral cartilage, tibia cartilage, and the meniscus. These are the cartilages you find in the knee joint. Without arthritis, they are very, very smooth and slippery. These cartilages are very smooth because arthritis has not started affecting them. Even if this patient is complaining of pain, the problem is at the ligament. So if you do x-ray at this point, you will see that the joint has a very good feature with a good space in between the bones, which represents the cartilage. When I said that arthritis destroys the joint just like the way acid destroys any object it is poured upon, this is what I meant. So from the ligament, it starts spreading into the joint and begin to affect the cartilage. The cartilages that used to be smooth and slippery are now fluffy, torn apart. This is what is known as wear and tear, which is also another way arthritis is described. And why does arthritis behave in this way? It behaves in this way because any joint that is suffering arthritis, there are two most dangerous chemicals that are released in such a joint. One is interleukin 1. The other is matrix metalloproteinase enzyme. These chemicals are like the acid that you pour on a flesh. These chemicals continue to progressively destroy the tissues of the joint. As you can see, the more the arthritis stays in the joint, the more it destroys the cartilages, exposing the bones of the joint. As you can see, the femur bone and the tibia bone. This is because of the wear and tear, persistent wear and tear of the cartilages, and from the cartilages it will enter into the bone and begin to destroy the bone. Arthritis behaves like an acid. It destroys everything around it. That is why arthritis has to be stopped before it completely destroys the joint. Unfortunately, there is no medications made yet that can stop the progression of the reactions of these chemicals. That is why no matter the amount of drug people take, no matter the kind of drugs taken, the common experience is that this arthritis will continue to progress and get worse. This is because these chemicals continue to perform their function, destroying the joint, not being affected by the drugs taken. But good thing, science has discovered there's a solution, there's a way to stop the progression of this arthritis and even to heal the joint and restore the joint back to normal. What I could consider what people have been looking for a solution of arthritis is not very far away from them. It is right there in your own blood. Yes, it is known as platelet cell, and it is a cell found in our blood. The platelet cell can perform this function because it has several active growth factors. These growth factors have different abilities. One, to heal the joint, to heal whatever is damaged in the joint. 2, to neutralize the effect of these two chemicals, the interleukin-1 and matrix metalloproteinase enzyme. Holistically, with the functions of all these active growth factors, which are over 12 of them, they restore the joint back to normal. Can every joint be healed? Unfortunately, the answer is no. This treatment is very, very efficient, especially when you start it at early stages of arthritis. At stage 0, stage 1, stage 2, it's wonderful that it can restore the joint permanently back to normal. But when one has been taking medications thinking that that is going to solve the problem, and you are now giving the arthritis time to fester in the joint, it can destroy the joint to the point that even when you start this treatment, you might not be guaranteed 100% solution or healing. The essence of this lecture is time. The earlier, the better. Remember, it is the damage in your joint that is responsible for the pain. So if you are taking medication to calm down the pain without healing the damage or the destruction, what we call degeneration in the joint, you are momentarily relieving the symptom. The pain will still come back as the degeneration gets worse. Thank you very much for your attention.